Hello and welcome everybody to this Health and Care Professions Council webinar for the Employer Insights. This webinar is around the standards of proficiency, which went live in September 23, and we'll also be covering some myth busting, some of the common myths that we've been encountering out and about and when engaging with registrants. So we always start our webinars by talking through the sort of Hello, My Name Is campaign, which was started by Dr. Kate Granger. So without further ado, I'll introduce myself. My name is Hugh Tregoning. I'm a professional liaison consultant for the HCPC based in Wales. I'm also a physiotherapist by background, a HCPC registrant, and I've been practicing as a physio since I think around 2008 in various guises. So I'll just hand over to my co-presenter today, Kim, just to introduce herself.
Yeah, hi there. My name's Kim Tolley. I'm a professional liaison consultant, exactly the same as Hugh, but I work in England and I'm a nurse by profession. Thanks, Hugh.
Perfect, thanks, Kim. So just going to run through a little bit of housekeeping, if you'll bear with me. So in order to protect the learning environment in events of this scale, we are required to automatically disable cameras and microphones, but we will be using the Q&A function on MS Teams, so you will be able to engage with us. We may not be able to get to all the questions that people ask, although there is a team in the background endeavouring to get through them, but we'll try to publish as many of them as possible. So if you do have any additional questions that aren't answered, or if you're watching the recording of this, then do feel free to contact us on the details that we provide throughout the presentation, and our email addresses will also be at the end of the session today. If you do encounter any technical difficulties, then there is a team on hand to help you, so do post in the Q&A. Hopefully we'll be able to sort of help you through those, but we will respond to those questions privately. And just to say that the event is being recorded, so at the end of today's webinar, we will also ask you to complete an evaluation form to understand your experiences and to support us to develop and improve our content in the future. So what are we going to cover today? So we're going to talk about what the HCPC is and does, and a little bit about regulation, the whys of regulation. And then we're going to talk about the professional liaison service, of which myself and Kim are a part, and what we're trying to achieve and what we're trying to do. We'll then get on to why we have standards. Then we'll talk about the standards of proficiency and some myths around them, and then cover off some resources and other sources of support which may help you and your employees or registrants to get to grips with the changes that have come in. So this is just a placeholder for resources. We'll talk through these in a little bit more detail later on. But you can access all the content around the webinars on the website. It's currently live, and you can also sign up for Employer Insights on the Employer Hub and access other up-to-date information for employers on the Employer Hub. And equally, if you're a registrant, you can sign up to the Registrant Hub, and also your registrants can sign up as well to stay abreast with all the things that are going on here at the Health and Care Professions Council. We also have a little sort of slide there just advertising our gap analysis tool. Other gap analysis tools do exist, but it's just a really useful way of thinking about your service and ensuring that you're tracking how you are in relation to the standards. So firstly, an introduction to the Health and Care Professions Council. And one thing we often ask registrants is why have regulation, why have a Health and Care Professions Council or standards? And a good place to start is around safety and the safety of healthcare. So the NHS was one of the first healthcare systems in the world to publish data on preventable deaths, and one estimate given is that there could be up to 9,000 preventable deaths in the NHS each year. Another estimate is also that there is 1 in 12 that experiences preventable harm as a result of their encounter with the NHS. Now, there's some important caveats around data. It's a notoriously difficult thing to measure. It may well be underestimated, and obviously it depends on what the authority is measuring, but we do know that there is significant harm that occurs as a result of people's encounters with healthcare. So that 9,000 figure is around 18 jumbo jets, and a question that I often ask registrants is, what would the Civil Aviation Authority do to not lose 18 jumbo jets each year? In fact, the Office for National Statistics said that in 2020, 22.8% of total deaths of all ages in Great Britain were considered avoidable. So that's 153,008 deaths. So aviation has gone on an incredible journey from being one of the most unsafe ways to travel to being one of the most safe. So first year of World War I, out of 100 planes lost, only 2 were lost to enemy action. And yet now you can jump on a plane in London and be in New York, and it's the safest way that you can possibly travel. So safe that we just carry on life as normal pretty much in the plane. And so there's some important lessons for healthcare to learn from this. And I know this is not a new point to say, but actually healthcare is still quite unsafe for many people that do encounter it. And so this is a message that we still need to go on a journey with. And another thing, a point that we often make is that 9,000 figure is actually harms that are easy to measure. And many of your registrants may say, well, I don't encounter high risk activities. I don't do anything that could lead to significant harm for patients, but that's often not actually true. And so what we'd encourage you and your registrants to do is to reflect on what harms or potential harms or adverse outcomes that people interacting with your service could experience. Because for me, it's not acceptable to say that because we don't measure something or we're not good at measuring something, that it doesn't exist and that it's not a problem. So one quote is one quote that I've heard is that actually healthcare is the 3rd biggest killer in the Western world. So a constant focus on safety is actually mission critical. And a useful question is, do we have our own version of the black box? So this is the red box that is sort of fixed into most modern planes, which can be used in the event of an accident or incident to analyse what might have gone wrong and to be able to share that learning to other operators of planes to prevent planes going down or incidents happening in the future. So the HCPC's core aim is public protection and protecting the reputation of the professions we regulate. And we do this through quality assuring education, maintaining a register, setting appropriate standards and responding to fitness to practice. Upstream regulation, which is what the professional liaison service is intended to support, is taking regulation away from merely the statutory functions, so our legal obligation to investigate concerns, into using data, learning, intelligence from fitness to practice and working in partnership with employers, registrants and other stakeholders to support and influence professionals to maintain high standards and to protect the public and to prevent harm. So this could be one part of healthcare's equivalent to that black box flight recorder, which you can see in the picture on the right hand side there. And I've put this picture in because it's just really interesting. So this has been fished off from the bottom of the ocean, and some black box flight recorders, the airline has looked for years to find them before they've eventually found them. And the data on that is so precious that it's being kept in a tank with the seawater where it was found, so that conditions, so it doesn't start to deteriorate anymore, because that information is really important to prevent future incidents. So why have standards? This is a really useful question to ask your registrants. So if you had a big red button and if you pressed it, the standards of proficiency would cease to exist. Would you press the button? So if you press it, the standards go, the standards of proficiency, standards of conduct, performance and ethics, maybe the standards for CPD, maybe the HCPC, maybe regulation altogether. What would be the consequences if you did press it? And another way to think about this is in relation to driving. So the Highway Code sets out the laws of the road in an easy to understand language. It helps us when we're learning to drive. It helps us to know what certain signs mean, what a stoplight looks like, who has priority at a roundabout. But imagine if the code didn't exist. So it might be really convenient if you're late for a party and you have to go a little bit above the speed limit to get there on time. But what if everyone was able to set their own laws, rules and standards for how to drive? And what would the roads be like? And so the key question for me is, would they be safer or more dangerous? So the Highway Code is useful because it gives us a shared understanding of what safe and effective driving is. And it can also be used by the police and the courts to determine the right course of action if something has gone wrong. But if it didn't exist, people would make their own rules about what a green light meant, for example, or a red light, you know, which direction to go roundabout, or whether you could just drive straight across it, and who is right of way and all the rest of it. And I think you get my point. So there's a potential for a real inconsistency of standards in driving, and as a result there's a serious potential for harm. So there might be some plus sides to not having standards in healthcare. So if you're having a bad day, you might worry a little bit less. Your service or your practice couldn't be benchmarked easily. You couldn't be compared unfavorably to someone else or another area. You'd be able to set independently what you felt was best for your patients. You might even save some money on professional fees. And these are some of the plus sides, but it'd be really useful to think about what some of the pitfalls would be. So in order to do that, what I'd like you to do is to navigate your way to slido.com if that's possible. So you can do that on an internet browser on your phone, and hopefully we can start to see some answers rolling in there. So brilliant, thanks to those who are already in. So there is a slight delay on Teams for events of this size, so I'll just give you a little while to get your answers in. And do feel free, it is anonymous, by the way, so if you don't think there would be any effects or consequences, and do feel free to put that as well.
I think it's interesting, Hugh, isn't it? Because you make the analogy between our standards, or all standards that are written. As a nurse, I have standards also for the NMC as well, and the driving Highway Code, which I think is a really good analogy, because for me it's about that shared understanding. And I love the fact that you say, of course, when we learn to drive, we read the Highway Code. And of course, when we learn to be a health profession, that's what we do. We read our standards, don't we? And we base everything we do, and our education's based on those standards. So I think it's really, that analogy is really interesting. And looking at the results that are coming back, people are really feeling that regulation and standard proficiency actually give us a variety of things, because this, I know this poll you can put multiple answers in, can't you? So it's quite nice to see that lots of people are, and really interestingly, not many people are saying none or very little, which I think is really interesting, isn't it?
Yeah, absolutely. I mean, one of the things that really struck me when trying to sort of think of these answers, you know, what might the consequences be, it was around consistency, which feeds into all the others, is that we are actually allowed, and we'll come on to this later, we are actually allowed to have a bad day as a human being and as a healthcare professional. But what we know from the data is that system failures lead to much greater harm overall. And so anything that we do that can lead to a greater level of consistency of how we track against the standards, assuming the standards are, you know, effective and meaningful, will result in greater safety. And ultimately, when none of us are in healthcare to harm people, and so that's why it's often really good to start with this as a sort of starting point before you talk about standards, which can otherwise seem like quite a dry topic. I don't know if you agree with that. That's just me.
No, I think, Hugh, there's a really fantastic quote in the chat I'll come to in a minute, but it says we should recognise that all human beings in the NHS, and we'll never eliminate harm, but I think what we need to do is acknowledge risk and identify learning and adjust culture with no blame. I mean, that's just exactly right, isn't it, really?
I often think about mountaineering, and so if you plan an expedition, it's not about eradicating risk, it's about managing risk. You know, some people draw parallels to the military, but you know, in the military, they are actually, I mean, they do a lot of things, right? But I mean, in a war situation, you're actually fighting against an enemy. Whereas in healthcare, it's inherently dangerous for patients, you know, who are already unwell in some shape or form. And so we are managing risk, not eradicating it. And so we're never going to get to the point where, you know, harms don't occur. But the evidence shows that we've got a journey to go on this, and that includes sort of people on the register with the HCPC, can't speak now. So brilliant. So thanks so much for those that are participating. I'm going to leave it open. There will be a slight pause as I click off the slide, but then you'll still be able to put your answers in if you want to do so.
Thanks, Hugh. And what we thought we'd do now was actually look at what the standards of proficiency actually say, because for you as employers, you might be concerned about the changes that have been made, the updates, and this might be what your registrants are worried about. So we're going to use this opportunity just to talk to you about what the standards say and the changes, but then also Hugh's going to move on to some of the myths that we've heard, as he said, from some of the registrants, things they might be worried about, and things for you as managers that you can reassure them about. So as you know, the standards of proficiency are part of a sort of package of standards that here at the HCPC have been developed in collaboration with registrants and professional bodies and patients, and they include the standards of proficiency, but also they include the standards of conduct, performance and ethics, and this continuing professional development and your registration standards. Now, just interestingly, so the new standards of proficiency, or the updated ones that have come into force on the 1st of September, currently in a process of looking at our standards of conduct, performance and ethics as well, that the consultation for that has just been completed, and they will come out the beginning of next year. So their cycle of looking at standards and making sure that they match and marry up with what's happening in practice is very important for us at the HCPC. And as you know, registrants, all your registrants must meet all the standards of proficiency to register with us and meet the standards relevant to their scope of practice to stay registered with us. Now, the standards of proficiency are a little bit different because there are standards for each registrant group. So the 15 professions that we regulate have their own standards of proficiency. So one of the things that's quite useful for you as employers, you'll know the registrants who you employ, and you'll know which standards you need to actually specifically look at. And as I've also already said, the most recent updates came into effect on the 1st of September. And the changes really reflect the extent of developments in practice for each of the professions. And that's really important to us, is thinking about what's the realities of practicing in today's healthcare landscape. So there's lots of information on our website I'm going to talk about in a minute, but also there are sort of two types of standard of proficiency. There's the generic standards of proficiency that apply to all the 15 professions, and there are the profession-specific standards of proficiency within each of those documents. So what we thought might be useful to you is just cover a few of the high-level principles, because we thought it might actually be useful to you to look at some of the changes that came in. So Hugh, would you mind moving to the next slide, where we've actually identified the sort of 6 key points that have been changed. So I'm just going to go through these very, very briefly, but one of the things we looked at was a greater focus on patients and service users and involving them in their care. Now, we know in healthcare that that's super important and essential for everything we do. And in our updated standards, we've been much more clear about that. It's been a much greater focus on that. And we've elevated the importance of registrants' mental and physical health. We've looked at expanding the role of equality, diversity and inclusion, looked at leadership at all levels. I'm going to come on to that in a second. Look at updating our information on digital skills, new technologies, and there's a new standard about promoting public health and preventing ill health. So the wording in our standards has moved away from a passive understanding of the standards towards a more active understanding. And looking at those passive and active wording, there's lots of information on our website about that. So the next slide shows a few of the changes, and we thought it might be useful as employers for you to know where to signpost your registrants to. So I've just chosen a couple: equality, diversity and inclusion. So on our website, we've got the summary of the changes, and you can actually go onto our website and actually look at the exact wording that's changed between the standards that were before September 2023 and the current standards. So they're quite nice for you to actually have a look at. And also we've got specific standard details, so we actually specifically write out what has changed, which is quite nice as well. So on the next slide, there's a lot of information for your registrants. We've spent quite a lot of time trying to think about what might be useful for you as employers, and we've included a fact sheet for each of the 6 changes, a very short summary video, and there's just an example of one down at the bottom of that slide, which is about a 2 or 3 minute short summary, which are quite nice just to show at your team meetings, actually signpost your registrants to. And then there's a longer 45-minute webinar that we've just completed for each one of those standard changes. And on the right hand side, there's a QR code to our web pages, and I know that Patrick and Becky in the background will pop up in chat the actual links to those web pages. I'm going to talk in a minute about where all this is brought together for you, but Hugh mentioned earlier about the employer newsletter, and our last employer newsletter was on the standards of proficiency, and that newsletter gave you, it's all in one place basically for you as employers. Everything you need to know for your registrants about the new standards of proficiency is all in that place, but it's all on our website, and like Hugh says, it's all available now. So the next slide is just a little bit about digital skills and new technologies. We know that the use of technologies has always been an important part of the way our registrants meet our standards, but we also know that this standard doesn't mean that registrants must be able to use all the technology relevant to their field. It's actually related to their scope of practice, and Hugh, I know, is going to look to this myth, because I know a lot of people are very worried about, you know, there's a long list of the standards of proficiency. Do I have to meet every one of those standards? And Hugh's going to look at that in a bit. But we know that registrants might find it useful to direct their CPD to new technologies relevant to their field. And again, we'll talk about that in a minute. The next one I just thought I'd signpost to you is leadership. In the standards, the former standards, we acknowledge that leadership, in the former standards, the leadership standards were about formal roles, formal leaders, managers, or supervision of others. And I think in healthcare also, we now know that actually all registrants should be able to demonstrate leadership skills in whatever roles and whatever grade they're in. So we've actually changed our standards and looked at that, the importance of leadership at all levels of practice, and also thinking that leadership means different things in different roles, and there's no set way to show leadership. So again, we've signposted there on the right hand side the expectations of registrants related specifically to this change in standards of proficiency. So I think this is a point that I hand over to you, Hugh.
Thank you, Kim. Yeah, so we're going to go through some of the most common myths that we've encountered just chatting to people. And to be honest with you, full disclosure now, these are some myths that I had myself. So I've been with the HCPC since March. As I said, I'm a physio, still a physio, and so this is why this is quite real to me, sort of going through these. So hopefully this is reassuring as we go through, and if you do have any further questions, then do feel free to stick them in the Q&A and we'll try and get to them. So myth number 1, I will need to prove I meet the new standard. So some of your registrants, and if you're a registrant yourself, you may be thinking that someday will come in the future, perhaps around your renewal window, where you'll need to evidence that you meet every standard point by point. And obviously there's a sense in which many of the standards may not apply if they're not within your scope, and you decide yourself what your scope of practice is. But we're just really talking with this myth about, will you actually need to stand up and evidence, before a panel, how you meet everything in any forum? So the clue is in the name of the slide here. It is a myth. So what actually happens, if you remember, if you have renewed before, is that you will be asked to sign the professional declaration when you come up for renewal. So that'll be every 2 years you sign a declaration, and when you do so, you're confirming that you've continued to meet the standard of proficiency for the safe and effective practice of your profession. You've not had a change relating to your character, and not had a significant change related to your health that may affect your ability to practice safely and effectively, and also continue to meet the HCPC standards for continuing professional development. So this is in actual fact what you as a registrant or your employees, registrants working in your service, will need to do. So it's not a question of standing up in front of a panel and talking through point by point how you've met it. So hopefully that's quite helpful. So this feeds into the next one, which is around if a registrant is called for CPD audit, would they need to evidence how they meet all the standards point by point? And, you know, there are some important caveats with this as well, but generally speaking, the answer to that is no. So with CPD audit, which is a common source of confusion and anxiety, you're actually asked to do some very kind of simple, straightforward things. So describe your current role, then list the CPD activities that you have partaken in. And then one option is that you reflect on 4 to 6 of them and explain how they changed your practice for the better of your patients. So I'll just go through that again. So you describe your current role, and that's really for the people looking at your submission to check what your scope of practice is, and then provide a dated list of your CPD activities. So it's obviously recommended to do that as you go along. Choose 4 to 6 of them, describe them, what did you learn, and how they improved your work for the patients. And then you'll need to provide evidence that shows that those activities have actually taken place in some shape or form. So even at CPD audit, registrants are not being asked to demonstrate how they meet every single one. There's a high degree of autonomy in how you evidence that you've met those CPD standards. There's a high degree of freedom within that. So myth number 3, the updated standards are introducing new expectations into my practice. Not true. So there is a sense in which it is true, right? I mean, you know, there may be standards in there that do challenge you or your service, that you need to upskill or learn about something or change a process. But this is probably because someone else is doing it and it's seen as sort of good practice. So what we're saying, and our key messaging, is what's actually happened with the standards is they've been revised to better reflect both contemporary practice and service user needs, and developed in sort of cooperation, partnership with registrants and professional bodies. So the word to think about and the word to use with registrants is about alignment, because when you think about the standards changing to align with what you're already doing, that's incredibly reassuring. So just that important caveat is that you may find there are things when you look at it and you perhaps do a gap analysis or a training needs analysis, there may be things that you or your team do need to upskill in, but in actual fact, the vast majority of things will be things you're already aware of, that are already on your radar, and you're already acting out in practice within your service. A great example of this are all the standards and codes and NICE guidelines and that sort of thing that are already out there. So if you think about it, when the HCPC went out and consulted on this, these are the things that were in the minds of the registrants and patients and professional bodies. These are some of the things that fed into the standards to be changed. And another really good example is around sort of COVID-19 and how many of us sort of pivoted to a digital only model, and the associated learning that had to happen alongside that had to be reflected, that need to adapt and adjust had to be reflected in the standards. And so we were playing catch up with practice rather than the other way around. So myth number 4, I must be perfect. So we're talking about the practice gap. It's an open secret in healthcare, as in life. Registrants don't always meet the standards. So if you look at those photos there, so if you're a parent or a carer, if you play sport at any level, if you've been in business, you know, whether you're running your own business or you work for an employer or in a healthcare team, you won't always meet the standard. So look at that diagram of the wave there, top right. The dashed line is sea level, and the peak of the wave, imagine it's like a day when you've absolutely nailed it and you've met the standard or exceeded the standard. And the trough of the wave is when you perhaps, for whatever reason, haven't. And what the regulator is looking for is the mindset of a professional and the ability to track where you are in relation to the standard on any given day, both on a personal level and as a service level. They're not asking necessarily for, you know, perfect knowledge, perfect skill, but actually looking for that mindset of being willing and brave enough to focus on error and to learn from it. So excellence comes from looking at error as much as looking at success. So the question for you as leaders is, how are you measuring psychological safety within your team, and how are you encouraging high levels of psychological safety and that sort of black box thinking? So learning from where things haven't gone so well to continually improve your service. So in other words, how are you monitoring the practice gap?
Thanks, Hugh. Sorry. So what we also thought might be useful, along with those mythbusters with your registrants that they might be asking you or might be worried about, that actually there is some really good information in our current employer newsletter that all talks about some ideas that you can use with your registrants to think about embedding those updated standards of proficiency. So our first one is, like I said earlier, downloading those new standards that apply to your employees. You might manage 2 or 3 groups of registrants. So it's important for you to have a read of those new updated standards as much as they have, really. And they're on our website. And I just wanted to say as well that there is some amazing material on the professional bodies websites. They've been working really hard as well to think about what might be useful for their registrants. So there's a super little HCPC awareness poster for your workplace if you want to print it off, or even if you just want to send it around to your registrants, that might be quite useful. It just gives you some tips and hints. So I think that's probably a first very, very easy step for you to do as employees, for you to sort of raise awareness really of the updated standards. So thanks, Hugh. The next idea that we've put out for you is you can encourage your employees to carry out a gap analysis. Now, this can be formal. You can send them the one that we've put on our website, because we've got one on our website that you might find useful. It doesn't have to be they fill it in. It can just be a conversation with you, an informal chat. It doesn't mean that everybody's got to do it. It's just another idea that we're putting out there, really. And doing a gap analysis actually can be incorporated into team meetings, into one-to-ones, as normal business as usual for you as employers. I think we're going to show in a minute how the gap analysis could lead to continuous improvement for you, could need ideas to improve practice that you could discuss with your employees. So this is just another useful tool that you might be able to use to facilitate a sort of group discussion or an individual discussion on things that need to be improved, really. So yeah, this is just another tip for you to use, and it's on our website. And I know that my colleagues in the background, Becky and Patrick, will pop the link up. I know they've put the generic link for the updated standards of proficiency, but this might be one that you actually like to have a little look at. So we thought we would have a go at doing that ourselves, and Hugh and I sat down and imagined that we were registrants and thought about some of the things that we thought about when we were thinking about our own practice that we could make improvements on. If we did a gap analysis on our own particular areas of practice, what would we come up with? So on the next slide is a couple of examples. All right, and this is just showing you the sort of things that people might come up with. So for example, I might do a case review of 10 sets of my written notes and realise that actually when I looked at it, that some of the things are missing, and actually some of the notes are hard to read, or I've not actually I've not done them very well. So that can lead into continuous improvement activity, can't it, really? And that leads me into do things like talk to my clinical supervisor, talk to my peers about it, my professional body, look what's written on my professional body about record keeping, take a course in record keeping, maybe investigate best practice, look at other colleagues' notes, so sort of do a sort of norming exercise between what I write and what other people write, and think about digital record keeping tools that might be useful for me. So there's a lot that it can lead to if you do a gap analysis and think about how it might lead to continuous improvement. And that, of course, is what's important for you as employers, I know. So another example is a registrant who works in the community supporting vulnerable groups and notices that certain patients are struggling to access services due to digital literacy requirements, for example. And again, thinking about that, identifying that for me as a registrant, I can think about things that I can do, again, talking to my clinical supervisor, thinking about with my peers, how can we improve things for clients and vulnerable groups, thinking about walking the journey to access my service with a patient, with a client, thinking about what signs are up, thinking about how they access that, the letters that come out to them, what actually is written, and does it have to be written? Are there other ways of communicating with people? And identifying, things to improve that. So it's about thinking what you can do as an employer to improve things. And I think we want to sort of say that it's all going to be different for every single employer in the whole country. And we think that probably there are things that come up with your employees, your registrants, that might lead to continuous improvement activities. So just if you might like to use the gap analysis, if it's useful to you, we put it out there really. So the third step in embedding the changes in the updated standard of proficiency is really, alongside encouraging your employees to read them, maybe ask them to present them at a team meeting. Ask them to reflect on whether they currently meet them, or they need to improve things or look at their practice in order to do so. So I always used to find it quite useful as a manager to actually ask for a volunteer. That's always a difficult thing to ask for, isn't it? Ask for a volunteer to see if somebody will present these changes, look at just have a live HCPC website in your team meeting and just talk people through what's available on our website. That might be something that you can do very, very easily. And the fourth step we suggest is to put the changes into practice, to allow your employees to make the standards. And I'm going to talk about that in a minute, and add it as an agenda to your next meeting or one-to-one, and allow employees to talk about their concerns or ask any questions. They can watch this webinar if they want to, and we've got lots of other webinars. So in our employer newsletter, our last one, we actually included 3 case studies from different employers to ask them how they embedded these standards of proficiency, and we just thought we'd share with you one of them, which is from Lewisham and Greenwich NHS Trust. And Dan Weston, who's the AHP Workforce Development Lead there, wrote a series of steps that he thought were really useful to embed these standards. First of all, he contextualised the changes and discussed the updated standards and how the registrants' work aligned with them. Then he made it clear to registrants that it's actually their responsibility. And as Hugh talked about earlier, it's in their professional declaration every time they sign that every 2 years. And he raised awareness of the HCPC resources, so signposted the registrants to the HCPC resources. He invited registrants to complete a gap analysis tool. We've talked a little bit about that, formally or informally. It's totally if you want to. And he looked at embedding the updates also into some of the core training programs that were run at the Trust, and signposting registrants to professional bodies as well, which is super, super important. So it was just an example. There are another couple of examples on our employer newsletter that you might like to have a little read about. And while we're on this issue about case studies, we're always looking for case studies of best practice. So if there's any case studies that you want to write for us, then do contact us at the Professional Liaison. We'd be really happy to work with you to write blogs, to contribute to our newsletters, because it's really good to have real life case studies and real life examples so that people can benefit from those. Thanks, Hugh. I'll pass back over to you if that's all right.
Yeah, definitely. On that note, sort of gap analysis really ties in with leadership and that principle of leadership at all levels. And you look at a lot of big healthcare stories, negative stories in the press. A lot of the learnings are about sort of system failures, but also about failure to speak up and speak out, not just about things that you see that lead to direct harm, but also just small scale service improvements. So sometimes leaders can't see what needs to be changed. And so embedding safety in your team for people to be able to constructively give feedback on processes can be a really effective way to improve the service. But what we love is when someone comes to us and says, look at what we're doing, and then we can share that, because there's nothing more motivating than, you know, good news stories of how people have embedded positive changes in really sort of sometimes complex, stressful and difficult situations. So yeah, do to bring those stories to us, and we'll happily sort of chat through and talk through them and share them if you're happy for us to do so. So this last little bit is just talk through the resources in a bit more detail and some other sources of support. So Kim has already mentioned the Employer Hub, so that QR code will take you directly there, or you can Google it, or you can search for it on our site. So both the Employer Hub and the Registrants Hub have really useful info and resources, not just around the standards, but all other things sort of relevant to the HCPC. And it is really on our plan to continually improve and add content that's useful, and also one-off webinars that are useful based on kind of current data and intelligence. And a lot of that data and intelligence will come from you. So if there's an emerging trend or issue that you'd like us to kind of cover to support you on, then please do feel free to approach us. And that's what the professional liaison service is all about. And yeah, so Kim has mentioned the in-brief videos and the webinars. There's also a fact sheet. All the standards are listed point by point. There's a kind of comparison between active language and passive language, and also what the previous standard said and the current standard said. So I would encourage you, if you haven't already, to go and have a look, and encourage your employees, registrants, to go and have a look. Get them all signed up on the Registrant Hub if they have not signed up, and just generally point yourself to the website and interact with us and speak to us and tell us how well we're doing and how else we can support you going forwards. So this is where we sort of come into land, really, and ask if there are any questions. So you won't be able to come off mute, but please do put any questions in the Q&A that you think we might be able to answer. No guarantees we'll definitely be able to answer it, but this is where I'll probably reach out to Patrick and ask if there are any specific questions that myself and Kim can have a go at answering.
Nothing quite at the moment, Hugh. You've touched on the one that that was said earlier about well, I suppose you can answer this question now, I suppose, because there was the comment bit that Kim spoke about eliminating harm, but there's a question about recognizing the safety concerns that you were talking about earlier. How has the new PSIRF methodology from NHS England been considered in the new standards? I don't know if you can answer that one, and I don't know what that acronym means, but
yeah.
It's fine. It's fine, Patrick. And just to say, I've answered it in chat, really, and I'd love to have a longer. It's a sort of conversation you would love to have over coffee, isn't it? Really, that's why it's always difficult on webinars, isn't it, to have one way conversations. So yes, they were, and there's a lot about compassionate regulation in all of our standards and guidance. It's one of our strategic aims. But I've just put out there, I'd love to have a chat with that person just to talk about it, really, and just to see if we are hitting the mark and if there's anything we can do better. Because as you know, we are reviewing the standards of conduct, forms and ethics, and it would also be heavily part of that. And I know our policy team would be really interested to have that chat as well. I know that they, as alongside talking to registrants, they scope all recent sort of policy documents exactly as this. And they look at the implications of all these things on our standards and guidance to make sure that everything is in alignment with current practice, really. So yeah.
Yeah, it's important to say as well that we are constantly developing materials in and around leadership and culture, and it's something that the NHS at a strategic level has been talking about for years. But we will be looking at this and delivering webinars and content in and around leadership and culture and sort of just and compassionate leadership models going forward into the future. So again, if you have any suggestions in and around that, or you've got any sort of case examples, we'd really like to, like Kim said, engage with you and hear what you have to say, so that we can make that content as relevant and useful as possible to have an impact on patient safety and also improving sort of conditions that people are working in. Any more questions, Patrick?
There's quite a big question here, not really to do with the standards, but I thought it's quite useful to flag things maybe. What is the threshold for reporting someone if there are fitness to practice concerns? Maybe do you want to talk about that in terms of the standards, Hugh? And I'll flag the resources and pages on our website that are very useful for this as well.
Yeah, sure. I mean, it would very much depend on what the issue is, and obviously this is probably not the forum to discuss the ins and outs, but I think it's useful to know that you can reach out to the HCPC on specific cases and speak to somebody in the fitness to practice team about your concerns. So obviously, if patient safety is at risk, then that's obviously a bit of a flag. So there is a lot of guidance on the website in and around thresholds and the process that you should follow, and hopefully Patrick will be able to get that in the Q&A and sort of publish it for us. I don't know if you want to come in on that, Kim.
No, I totally agree. There's stacks, and we're also very, very happy to come and talk to you if you've got concerns about things like that, that we can actually do a session for you on those exact things. That would be absolutely fine as well. I can also see a question, Patrick, on what support do we have for those who are neurodiverse? And I'm not sure if that means on our website, what support do we have, or what support generally do we have? So I'd be really grateful if that person, and I haven't typed in the, just typing, I think I've misspelt the professional liaison, here we go. Do give us a ring, give us an email if you'd like, and it'd be great to have a conversation to see what specific, where is the support, where is your support, but what are you concerned about, because we'd definitely like to talk to you about that. Yeah, absolutely. So I've popped our email in the chat if that's okay, and just drop us an email, that'd be perfect. Sorry, I was just writing it just then, apologies. Is that okay, Hugh?
Yeah, that's great. Thanks, Kim. And thanks everyone for coming along. And yeah, hopefully this is part of an ongoing relationship with you. So do reach out if you've got any sort of comments, questions or ideas. That'd be great.